As more and more service members come home with President Obama's withdrawal plans for both Iraq and Afghanistan, the effects of traumatic brain injury, post-traumatic stress disorder, and other psychological health problems will undoubtedly be more widespread. According to Dr. Andrew Stone, director of the PTSD clinical team at the Philadelphia VA Medical Center, of the 500,000 veterans of the Iraq and Afghanistan conflicts who have visited the VA since 2002, 92% have possible mental disorders. These service members, either home between deployments or back permanently, often find it difficult to return to civilian life, families, friends, employment, education. Different types of treatments have been used, from medication to talk therapy, but there are other types of therapies less spoken about that are doing much good for these men and women. One of them is through art.
There's a lot of attention to art therapy right now. I think a lot of people intuitively understand that art is very helpful in ways that maybe other kinds of treatments are not.
That's Kathy Malchiotti, a leading art therapist in the field for 25 years and president of the international organization Art Therapy Without Borders. According to Malchiotti, the use of art therapy for service members, especially those who have been in combat, is increasing nationwide. Art therapists have a degree in art therapy or a related field at a minimum. Many are also licensed professional clinical counselors, like Malchiotti. Art therapy traditionally takes two routes, focusing on the art making as a therapeutic activity, or using the artwork to build a relationship between the therapist and the client, a starting point for talk therapy. Malchiotti explains why art therapy in general is so successful with trauma victims.
The use of cognitive behavioral therapy is very popular, which is a form of talk therapy. But I think what people are starting to find out is, and veterans are giving us this information too by their first-person accounts, they need something more sensory and less language-driven to process and communicate what happened to them. Because if we go through a very traumatic event, we don't have words for it, and there's a reason for that. The brain does not encode it that way. Well, if you talk to a military veteran, for example, that's been in an explosion, they may cite what they saw, but also what they smelled and what they heard. And they may not be able to describe that in words.
Art therapy has been around for a while, increasing in use with World War II veterans and more so with Vietnam veterans, but is now more widely recognized as a helpful and rewarding therapy. Expressing difficult events through a creative outlet can be a powerful healing mechanism for service members, especially those in combat. Malchiotti describes these soldiers.
The skills that they developed in being good warriors helped them stay alive and help them protect their buddies when they were out on a mission. But those things, when they bring them back, having to eat quickly, be hyper alert, sleep lightly, always ready to respond to danger, now those behaviors are kind of getting in the way, because that's not the way regular life is.
Art therapy aims to ease the effects of these behaviors. Melissa Walker, an art therapist at the National Intrepid Center of Excellence, NICO, which treats active duty service members mostly for TBI and PTSD, and also the center's Healing Arts Program coordinator, further discusses why verbal work with trauma victims is not always the most effective treatment.
They did some scans while people were creating art and when they were also verbalizing trauma. When you're trying to verbalize trauma, your left frontal lobe kind of shuts down. That's where the Broca's area, the speech area of the brain is. But the right hemisphere lights up, and that's, of course, the side that we use to be creative. So they've just found that for some of these people who have been through these traumas, it's much easier to express themselves through a nonverbal modality.
Walker agrees with Malchiotti about the power of art therapy. She says it has myriad benefits, from beginning to talk about the trauma, to learning to relax, to increasing self-esteem, to being able to live a more normal life.
And I say, I'm so angry, I have the worst outbursts, I say, well then great, art therapy might be good for your relaxation or an outlet for you to come anytime you feel like you're getting angry, you can sit down and maybe get some of that out on paper. Or if they say, I'm having a really hard time focusing, well then something that they can feel proud of is that they sat there for an hour and a half and worked on a piece of art. Because it's an extension of themselves, they can see what they've been through right before their eyes.
Art therapy is applied in response to diagnosis and symptoms. Walker at NICO and Malchiotti at her private practice both meet one-on-one with service members to decide how to best conduct the therapy. Both therapists spoke about first trying to help their patients to relax and, once comfortable, to then introduce the art activity. There are varying techniques employed and levels of engagement with the actual trauma. Art therapy, like many therapies, is practiced on a continuum. Malchiodi does a great deal of work in exposure therapy.
A lot of people that have post-traumatic stress do have some very terrible memories of things that happened. And at that point, what I try to do with them kind of reflects on the whole idea of exposure therapy, in the sense that now we might be doing some actual artwork about what happened.
Malchiodi talks about witnessing what soldiers call pink mist, when a person's body is completely destroyed in an explosion.
One of the people that I've worked with recently in this particular case, that's what this person needed to finally be able to express on paper, was what that looked like, what that felt like, and realize that happened, but it's now in the past. And I think that's what the art helps with too, because it makes it concrete. It's an image that never was expressed, but is held in the body and has been disturbing, and to be able to put it out on paper and then be able to talk about it is a very powerful thing.
Within art therapy, there is quite the range of media employed and supplies used. Walker has found one in particular to be rewarding.
When I started working with the service members individually, I felt with some of them was reconnecting with their identities. Who am I since the injury? Who was I before? Why am I not enjoying the things I used to? In realizing that, I thought mask making would be something that they would really connect with, and it has worked.
Walker says the service members talk about two sides to themselves, one in combat, another one at home with their families.
So their masks will literally end up divided in half, so you see half of the mask is angry and red, or this was the injury, and then half of it's serene. But we're also seeing some of them dealing with the death and the grief they experienced while they were over there. So there's been quite a few skulls, bloody tears. What else are we seeing? Some patriotism, of course. So a lot of red, white, and blue. They really get into it. The symbolism is amazing, down to every last dot. It's pretty incredible. So I think for them, it's nice to be able to think about who I am, who am I. They put it very eloquently in one group. We're trying to find, quote unquote, the new normal. Since I was injured, what is the new normal?
Both Malchiodi and Walker have learned a great deal from the service members. Malchiodi expressed a sense of humility when working with them.
I sit there and listen, and I say, I don't know, honestly, if I could have done what you were able to do. And a lot of times the people I'm working with will kind of chuckle and say, no, Kathy, you haven't had the training. I always commend them. And some of the work we do in art therapy, too, is about, making a collage or some kind of artwork that really capitalizes and commemorates their bravery and the skill set that they have. I just can't even imagine learning how to be able to protect people in the way that our military successfully do every day.
Walker feels a similar admiration.
They've really humbled me. I respect them. I respect what they do. I see how passionate they are about this, even if it's not necessarily the mission of the war, but just in general their careers, and then also fighting for us. I've seen many of them just be heartbroken because they can't go back and be a part of it. I mean, honestly, it's just amazing. I mean, to know what they've been through and then know that they just want to continue serving our country, I think it takes a very special person.
To view some of the service members' artwork, visit our website, warnewsradio.org. For War News Radio, I'm Elliana Bisgaard-Church.